Hey, Dominic here from Body Mind Fitness, and I want to show you today how to check if you have abdominal separation, which is also known as a diastasis recti. So when we're talking about diastasis recti, the first thing I want to tell you is this does not mean your abdominals have split apart. And it's important for me to say this to you because I talk to a lot of women who believe this to be the case. And I thought that too. Before I started specializing in pelvic health, that is what I thought happened. Your abdominals split apart and that's it. Now, the other thing that I wanted to mention is that it is not exclusive to women who have been pregnant. However, I do want to touch on the pregnancy thing for just a moment. When you are pregnant, if you've ever looked at a diagram of like the six-pack muscles, and there's this little space in between. So this goes for everyone, not just my pregnant mamas. And this space is called the linea alba. As you progress through your pregnancy, that linea alba starts to soften and starts to stretch out to make room for your baby. This is completely normal, and by 36 weeks pregnant, 100% of women have it. That is what newer studies are showing. So this is not something that you need to try to avoid. There's definitely things that you can do to try to minimize it, but there is going to be some amount of it as, again, you progress through your pregnancy. On the flip side, like I said, not exclusive to pregnancy and not exclusive to even women. If you've ever seen those like guys who are really shredded and their six-pack muscles are like sticking out and they have that huge gap between their six-pack muscles, that's also a diastasis recti. There is a big gap in there. We're looking at a diastasis recti. So let's go right to it because I don't want to take up too much of your time, and I do have this tendency to like go way off on a tangent when the purpose of today is for me to just show you how you can check for yourself. With that said, I do want to mention that if you have the ability, go see your friendly neighborhood pelvic floor physiotherapist, even if it's just for one visit. It is an extra cost, and if you do not have any coverage that covers physiotherapy, it will come out of pocket, but just one visit just to see exactly what is happening within your body, getting the exercises that you need, and then going with that is going to make the world of a difference. And as you're progressing, this is something you might want to be checking in on yourself periodically. So we're going to make our way down to the floor, onto our side and onto our back. And you're going to want to lift up your shirt to just around your bra line. And you're also going to want to roll down your pants to expose your belly button and some of the lower abdominals as well. So from here, we're going to take two fingers and we're going to take them horizontal. So again, when I was reading about this, I was like, what am I looking for? What does this feel like? And I was actually putting my fingers this way and I couldn't understand why I couldn't feel anything. So they are horizontal, where essentially both fingernails are facing down towards your knees. So you're going to start around the belly button because that's a pretty easy place to go. And you're just going to apply a little bit of pressure downward, okay? And then you can head up a little bit, and we're just sort of palpating this tissue and just starting to notice what you feel. Are you feeling like a little bit of a spring to it? Or does it feel like a little bit of a hole where your fingers are just sort of dropping in? I'm not sure which is the best angle for my hands. There we go. So we're just feeling around and noticing what we feel, okay? Then we're going to go back to the belly button, and we're just going to apply a little bit of pressure right around the belly button area. I'm going to take a breath in, exhale, and just lift your head off the floor and notice what you feel. And then light back down. Then we're going to go about 2 to 3 inches above the belly button. Again, a little bit of pressure, nothing, we're not jamming our fingers in there, just a little bit of pressure. And then once again, taking a breath in, exhale, lifting the head and noticing what you feel. So we're trying to see if we feel any tension being generated underneath the fingers. And then we're going to go a little bit below the belly button. So again, about 2 inches, pressing straight down. Take a breath in, exhale, lift the head, and notice what you feel. Okay? And you just need to go over this once. So as I mentioned, it can be a little bit difficult to really find what you're looking for. So some of the things that I noticed for myself early on in pregnancy is I could feel sort of the two sides of my six-pack muscles kind of drawing together and squeezing my fingers. as a little bit more time progressed, I also noticed that linea alba starting to push up on my fingers. So that's what we're talking about in terms of generating tension. You want to feel your skin, or your muscles, I should say, getting a little bit harder and pushing up against your fingers. Now, if your fingers drop in and you feel that hug around your fingers, but you're not feeling any resistance upward, that is something that needs to be worked on with specialized training. So either somebody who is yoga instructor, personal trainer, certified in pelvic floor physiotherapy, or of course, as I mentioned, visiting a local pelvic health physiotherapist or physical therapist if you're in the States. So I hope this was helpful today. If you have any questions, feel free to post them below. And aside from that, thank you so much for taking time out of your day, for taking care of your health, and I look forward to checking in with you again sometime soon. Bye for now.